Hi, I'm Siobhán, one of the journalists up at Manx Radio. Welcome to the latest edition of our newscast. This time, I'm telling you all about a women's health strategy that's been launched online. Manx Care wants to hear your views on the future of healthcare provision for women here on the Isle of Man. They say the strategy is centred around a life course approach where every aspect of a woman's life and her health needs are viewed as a continuum, and that it's vital that they engage with service users at the beginning of this journey to obtain their views. I went up to Nobles Hospital and met with some of the women who are at the forefront of trying to shape this strategy.
Hi, I'm Michelle Moroney and I'm a consultant gynaecologist at Nobles Hospital, but now essentially retired from practice.
Hi, I'm Linda Thompson. I'm the Clinical Care Group Manager for the Integrated Women, Children and Families Care Group at Manx Care.
So we're here talking about there's consultations gone live online last week. Can you just tell me about what it's about, what the vision is here?
Yes, so the Women's Health Consultation has gone out and it's to enable the women of the Isle of Man to inform health services of how they would like us to shape services that are going to be deliverable to them in the future. It's a vision, it's going to happen over a long period of time. We're not expecting any immediate changes, there will be some quick wins, but it's to shape and inform how we deliver services for women on the Isle of Man, and their voice is so important because it's about them taking control, it's about them shaping what that looks like because they are the ones who know what they require.
And so when you actually look at the questionnaire on there's things like prioritise which of these topics are most important to you and things like that. So are you expecting people to really engage with the issues that actually affect them?
Yeah, most definitely. And I think what we have to acknowledge is that what affects one woman does not necessarily affect another woman. And that's why it's out to all age groups, 16 and above. I think what we need to acknowledge is that when a woman has a health problem or needs some health advice or guidance, it becomes a priority at the time that it presents itself. I think as a woman, you have many priorities that you have to juggle within life. And I think it's about establishing what has been important historically, what's important currently, and actually what concerns women going forward. So rather than it being reactive to how it stands today, it's about thinking about the wider picture to inform how we make women's health services on the island robust enough to meet that whole trajectory of 16 across through to old age.
So why specifically a women's health strategy?
Okay, so we're following our partners across the waters. So in the UK currently, the Women's Health Strategy was launched 18 months ago. So we're not reinventing anything. We're just following what is best practice. And what is recognised is that women's health is not given the priority that it should. We are at a deficit. However, what we also recognise is that women are the nucleus of most families. Not all, but the majority of families. And if a woman is well looked after, then she will ensure, as the gatekeeper, that everybody's health within the family that is well looked after as well. And I think we have lots of people who already inform and shape services through focus groups, through complaints, through good experiences. And what's come through is that some of the things we're doing really well, but there are lots of things that we need to improve on. And those are the quick wins. So where we can make changes and affect changes so women's experiences are improved significantly quicker, those are things that we will be able to do without any extra resource. It's about working differently. But there'll be additional things that women will highlight that we will have to enhance. We will have to look at what resources is required to deliver those things. But with health, both physical and emotional, it's a changing world. Science informs where we go and what we do. So for me, it's just the best opportunity to redirect how we should care for women.
So yourself, obviously, a very long history, specifically with fertility treatment on the island. So on the ground, are you hoping that you can take those experiences and help inform this strategy from a professional level?
Well, first of all, obviously I've got the history on the Isle of Man, and equally I have the experience of dealing with complaints, dealing with problems that women have encountered while going through the service. I do think, however, we need to ask women what they want from the UK women's health focus groups. The main issues affecting women does affect where they are in their stages of life. In the mid-years, yes, fertility is one of the big issues, equally contraception. And so that, again, hopefully we will hear voices back on those issues and access to services. in terms of later life, one of the main issues where I have also an interest in is menopause care. Women will spend up to 20 years in their perimenopause and menopause, and it's at that stage when they've finished having their families, they are a very important part of the workforce, and women's health and keeping them in the workplace is absolutely paramount. And this needs to be realised, and it needs to be recognised, and it needs to be addressed. And in terms of menopause care, we really are looking at that primarily coming out of primary care. But yes, the fertility, contraception, it is a huge span of women's health problems, and it will be very interesting to see where priorities are. Because we are unique on the island. We are an island. You can't just go down the road to a different place. We have to provide these services here.
Do you think that's key then for patients as you've experienced?
Well, certainly in my experience, I think from the patient's point of view, I think that yes, patients much prefer to have their treatment locally. It's a big deal to have to travel over to the UK for treatments. However, we aren't in a position on the Isle of Man where we can provide all aspects of healthcare here. We don't have the numbers, we don't have the expertise, and it is exactly the same in the UK. District general hospitals do not deal with all complexities of treatments across the board. They will refer to tertiary centres, so therefore we've still got to be able to do that.
In terms of making the strategy, you were saying before it's looking almost like for a 10-year span of trying to implement this, but also like you also mentioned, the medical science moves on all the time. So how do you kind of build into this strategy kind of contingencies for things that move on as it goes on?
I think as a health provider, that's something that routinely occurs anyway. So any medical practitioner or nurse practitioner have to abide by their code of conduct, and within that, making sure that you're fit for practice comes revalidation, comes education, comes training. So that's what informs. So there are constantly new developments, and we are responsible as practitioners to deliver on those new developments through processes, through commissioning. I think the strategy will highlight areas which women are passionate about us getting right, and once we've been able to evidence what those 5 key priority areas are, we can address our resource, our energies, and we can start to build our plans about future-proofing that. Now, in 10 years' time, who knows what will be available, but we're always striving to deliver excellence and nice guidance, evidence-based care.
And this obviously, consultation is the first stage of all that. Once you've then got plans, starting to formulate, will the public be engaged again, or will you just sort of be doing regular updates on where this strategy is sort of headed? Okay,
so of course it will continue to need to be informed. So we're then going to look at focus groups. So those women of the Isle of Man who want to take a greater part in shaping services forward, there will be an opportunity for women to have their voice heard. We are adopting a small team around making sure that we get as much information as quality information as possible, and there'll be regular updates that will be provided on an ongoing basis, because we know it's so topical, and we know from women, we know how passionate they are about us getting this right, that they will be on that journey with us. We would not doubt that women are going to come and travel this journey, because it's so important.
This strategy is looking towards the future, but what's the shape of women's healthcare on the island as it stands?
Okay, so I would hate anybody to think that we haven't shaped in the last 4 years, because we most definitely have. Just in part of COVID being, involved in that as well. So we have listened to women. So we have made some changes. So we've moved towards a fully integrated sexual health service for both men and women. Additionally, we have adopted a gynaecologist service for women. So it's now on par with other cancers across Manx Care. Additionally, we've also supported a fully implemented service on island for termination services for those women who choose to have termination treatment on island. And then finally, lots of women have experienced quite dramatic traumas in regards to miscarriage, and we've identified that our early pregnancy admissions unit needed to be revamped. We're in the process of commencing some building works within the care group, which will enable a seamless service for every woman to come through in the early days of her pregnancy, where she requires any additional interventions or, sadly, to manage a miscarriage for that family.
What would your message be to women in terms of this consultation? Obviously, get on there and fill it out, but how important is it for them to engage?
I think it is extremely important. The survey itself is actually great. It is so easy to access. It is so easy to do, and it is so important that we know what women want. We might think we do, but unless we actually ask, and unless women across the board, and indeed the survey is not only for women, the survey can equally be filled in by men about their partners, about their friends, about their family. And I think that unless we hear back and we get a good response across the board, we might fail in terms of delivering services for the future. We need to know what people want and how can we get them to get their needs.
Anything to add?
I just think it's a really exciting opportunity, and as Mrs. Moroney has just said, it's straightforward for those who wish to do it electronically, but there will be paper versions made available across GP sites and other health clinic settings. It's confidential unless you want to have something, or share something on, that you don't mind sharing your identity. But for me, it's something. It's a win-win situation, and without sounding patronising, I just don't know why women wouldn't complete the survey, because it's in everybody's best interest.
We can find it on the government's consultation portal.
Yeah, so it's easily accessible, and there are links, and if anybody's struggling, then they can phone through to our MCALS department and they can point them in the right direction.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.